Alright, what is up everyone? Welcome back to the channel. It is the beginning of my third week of my OBGYN rotation, which means I'm almost already halfway through. It's crazy how fast these 6-week rotations fly by. This week I am on an outpatient clinic week again. Last week was like our subspecialty clinic week, so every day we were in a different specialty. And a lot of stuff that is like very subspecialized, like maternal fetal medicine and REI. However, this week is just going to be in our like resident run free clinic. And it's going to be a lot more just like bread and butter obstetrics and gynecology. So today is day one. It is going to be all OB clinic. So that's going to be exciting to get a little bit more experience with that. Last week, 2 of our days were with MFM. So that's going to be today. And then tomorrow is actually going to be an ED shift. So it's going to be my last ED shift ever, which is crazy. Wednesday is going to be another obstetrics day. And then I think Thursday is our only like gynecology clinic day. Friday is our didactics day. So it's just going to be virtual classes. And I think we only have like 1 or 2 lectures scheduled. So it's be a really good day to catch up on some studying. All right, it is now Wednesday. I just got back from clinic. I guess I'll first cover how yesterday went in the ED and then just kind of lump together both of my OB clinic days. So honestly, my last emergency medicine shift was a little underwhelming. So I was in the fast track, which is sort of like a in between emergency medicine and like urgent care kind of like acuity, I guess. So see like a lot of ankle sprains, abdominal pain, stuff like that, where the patient is very stable, as in like their vitals are normal or they just don't have a lot of comorbid conditions. So generally it's some less exciting things, and it was just like a super slow day for some reason. My last ED shift was in that same area, and it was on the same day of the week, a Tuesday, and it was crazy. But yesterday, for whatever reason, people just didn't want to come into the ED. So I got to leave a little bit early just because the doctor was like, hey, it's your last day. It's a beautiful day. There's nothing going on. So get out of here. So that was really nice of her. In terms of obstetric clinic, these, Monday and then earlier today, it has been very fast paced. I've liked it. I feel like the day is flying by just because like we're constantly seeing patients. Sort of the general workflow of how everything has been going is we'll keep an eye out on the rooms and like Epic to see which patients are getting here. Me and one other student will kind of split up all the patients, so we will start like reading on them. Sometimes patients, it's like their first time in, so there's nothing really in Epic. But yeah, we'll just chart check them and then wait for them to be ready. We will go see the patient, try to do as much of the history as we can, and then we'll go and present it to the resident to give them sort of an update. Usually we'll be presenting while they're like typing out their note just to help them save time. And then we'll go back in the room with the resident. They will, clarify anything that we didn't really get in terms of our history, and then we'll do the physical exam together. For obstetrics, sometimes the physical exam is just doing a fundal height measurement, which you just take a little like tape measure and measure how big the belly is. And then you'll use a Doppler to listen to the baby's heart rate, make sure it's in a normal range, and that's it. But sometimes for like an initial OB visit, usually you'll do a pelvic exam and a pap smear. So we were able to help with a few of those, which was really nice. Also got to see transvaginal ultrasounds, which that was my first time really seeing that. Nice for the residents to talk me through like what she was seeing, what she was trying to check. We just did a few measurements, just try to estimate the week gestation of some of the babies. So yeah, all in all, it was good. Like I said, it went by pretty fast. I like blink and it was our time to leave. So I think that's probably a good sign. Tomorrow is going to be our only day of gynecology clinic. There's actually one patient who we saw today who's coming back tomorrow to get a colposcopy, which is a test to sort of further evaluate a cervix to see if there's any maybe potentially cancerous or precancerous lesions. So as I mentioned, in a lot of initial prenatal visits, they'll do a pap smear, so checking the cervix for any atypical cells. So dependent on the results of that test, as well as some like maternal risk factors like age, any prior pap abnormalities, sometimes you'll just watch and wait, repeat a pap in X amount of years, or sometimes you have to do a colposcopy even if the patient is pregnant. It's actually interesting because I had two patients today. Both of them had the same results on their pap smear. It was like low-grade squamous intraepithelial lesion, something like that. And for one of them, we were just like watching and waiting. She was going to get another one after the pregnancy. But for the other patient, we're doing the colp tomorrow. So I'd asked the resident, I was like, all right, don't really understand. They got the same exact results on this test. Like, why is the management different? So we plugged a bunch of like the risk factors that I was talking about into a calculator, and that's kind of how they determined that one patient was good for a little bit, the other patient needed some more testing. It is Thursday. Just got home from my day of gynecology clinic. One very similar to the past few days of OB clinic, just less focus on pregnant patients and more just like routine visits, patients coming in because they hadn't had a pap smear for a while. There were a few patients with like problem visits of like pelvic pain, stuff like that. So there was a little bit of variety, but for the most part, it was just like routine screening. Got to do a few pap smears. I did an IUD removal, so that was pretty cool. It's like a little bit more unique that students don't get to do every single day. And then, as I mentioned earlier, I did have a patient from my OB clinic yesterday that was getting a colposcopy today, so I wanted to go to it, see what that was like. It's also like a more rare procedure and it's a lot more involved. So basically how it works is, you do a speculum exam and then you look with a microscope at the cervix. You put a certain solution on the cervix and, based on the kind of cells that are on the cervix, it'll sort of change colors. Trying to just make it as simple as possible. So you look at the cervix through the microscope after you put that solution on, and then based on what you see with like the color change and frothing and all this kind of stuff, you decide if you want to do a biopsy or not. Pretty straightforward, simple procedure, but it was actually a lot more exciting and a little bit scary. So it was, I think, either like a second or third year resident who was going to do the colposcopy. She got everything set up, got the microscope, was starting to put the solution on, and it was taking her a while to sort of make a decision on if she wanted to biopsy. So after a little bit of the resident trying to, put the solution on, look, she is talking to the nurse, talking to me. She's like, kind of just seems like everything is turning white, which that's kind of like the positive, like, oh, you need to biopsy this, as if it turns white. So she was just a little bit confused because that's very abnormal. And then she was also saying that it seemed like her cervix was like a little bit dilated. So she wanted me to go get the attending. So I leave the room, go grab the attending so she can come help out. And the attending sees the same thing. It looks like this patient's cervix is dilated, which could be a normal thing based on the gestation. However, this patient was only 28 weeks. So it's very early for your cervix to start to dilate. They kind of abandon the colposcopy, then they do a sterile vaginal exam to try to like actually measure how dilated her cervix is. And the resident was like, it's 3 to 4 centimeters, which the spectrum of cervical dilation is like basically 0 is not dilated at all, which is kind of what you should be at this week gestation, all the way up to 10 is like fully dilated, you're having a baby. So she was sort of on her way to a critical point of like 6 centimeters dilated. Once patients get 6 centimeters, they usually rapidly progress to 10. So kind of anytime a patient is prematurely dilated, you need to go to the hospital to get a more thorough workup of like why this is happening, and then maybe get some interventions to prevent any further progress. So it was, like I said, kind of a scary situation because this patient is, prematurely having her cervix dilate. She is at 28 weeks gestation, which is extremely early. It's just barely into the 3rd trimester. So we tried to explain everything to her, say that nothing is like emergently going on right this second, but there are some very concerning signs that she needs to go to the hospital right now to go to our labor and delivery unit, get a workup by the team there, and see if anything needs to be done. So this was kind of towards the end of the day, so I'm not sure exactly what happened to the patient, but she got over to the hospital and, she was in the appropriate hands. It's crazy, this kind of stuff just always happens in medicine. You have a certain plan, you have whatever you expect is going to happen, and then once you actually start the surgery, start the procedure, things can change drastically. I mean, honestly, it's a good thing that she came in for the colposcopy because we wouldn't have really known that she was that dilated. As I mentioned earlier on in the video, a lot of like routine prenatal visits don't involve a pelvic exam. If she was not reporting any bleeding or any pain or anything like that, we just measure her belly and listen to the heart rate. So we wouldn't have really known that she was dilated if we didn't do this colposcopy. So yeah, all in all, exciting day. Very educational. It was nice that I was able to do some hands-on stuff and start to become more comfortable with this field. All right, well, that is going to do it for today's video. If you enjoyed, please be sure to leave a like below and subscribe if you want to see videos like this in the future. Thanks, and I'll see you in the next one.